Law 202 Case Study by Emily Fisher. Introduction. There are current negotiations in Ontario between Indigenous leaders in order to create a new healthcare agreement for Northern Ontario reserves and Indigenous groups. The aim of the new healthcare agreement is to allow Indigenous leaders to decide how healthcare is distributed and executed, and what specific areas need extra attention or specific needs that differ from non-Indigenous groups. This agreement is an attempt to decolonize an aspect of Indigenous life, as Indigenous healthcare rights were taken away due to colonization. Historical context. Indigenous groups have traditionally used many methods of healing, including chanting, smudging, sweat lodges, and music, and are all aimed at cleansing the soul, which is the main aspect of Indigenous healthcare. Starting in 1904, the Canadian Department of Indian Affairs began to develop medical programs and health facilities for Indigenous communities to help treat smallpox and tuberculosis, and thus began the Canadian government's official intervention in Indigenous healthcare. By 1979, the Indian Health Policy was announced, which recognized the need for a strong relationship between Indigenous peoples and the Canadian healthcare system in order for both the Canadian government to still be involved in providing healthcare and for Indigenous peoples to accept the healthcare the government was providing, even though it was ultimately not the healthcare they particularly needed. Also, the image used on the right of this presentation slide is the Indigenous medicine wheel, which emphasizes spirituality and importance with healing. Moving away from colonialism. This agreement allows Indigenous peoples to focus on healthcare that is relevant to them, including returning to traditional ways of healthcare, especially Indigenous emphasis on cleansing and healing the soul when performing any kind of healthcare administration. It reinforces the notion that Indigenous peoples do not face the same problems as non-Indigenous peoples. Acknowledging that Indigenous peoples are subject to different issues and circumstances than non-Indigenous peoples means that the government is now accepting the need for different acts of care and showing that the Indigenous are different peoples whose problems deserve to be handled applicably and contextually. Colonialism has affected Indigenous healthcare and caused the problems that have arisen out of the inadequate distribution of healthcare amongst Indigenous peoples. Both directly and indirectly, colonialism has affected Indigenous healthcare negatively. Directly, colonialism took away Indigenous peoples' right and availability to their own healthcare by trying to cleanse them of their heritage. This discredited how Indigenous peoples traditionally dealt with healthcare and introduced a foreign way of healthcare that did not mix well with Indigenous communities. Indirectly, acts of colonialism such as residential schools have had a lasting effect on Indigenous peoples and their mental health, which is still currently a huge problem in many reserves and Indigenous communities. Indigenous peoples will ultimately be less physically dependent on the Canadian government, allowing them to focus more on their own traditions and practices. By not having to rely on the Canadian government to administer and plan healthcare in Indigenous communities, Indigenous people are able to become more independent and autonomous, and will be able to further focus on building and restoring their own traditional ways of healthcare through self-governance. An overview of the bill and what decisions have been made. The new agreement is aiming to allow the Anishinaabe-Aski Nation and 49 other communities in Northern Ontario to design and have control over their own healthcare. The federal, provincial, and the Indigenous governments have also created the Pikangikum Action Plan. The Pikangikum Action Plan is an immediate plan created by the Ontario government in order to address the mental health and suicide crisis that is currently plaguing numerous Northern Ontario reserves, specifically the community Pikangikum. In order to do so, this plan is sending 20 emergency full-time mental health workers to Pikangikum First Nation. Ontario's northern Indigenous groups and doctors have blamed the current healthcare system for their recent mental health crisis by neglecting to acknowledge the mental health pandemic, as well as through the effects of colonial government actions that have broken families, communities, and Indigenous traditions. Issues with Indigenous healthcare. Due to Indigenous groups' inadequate living conditions and lack of resources, their healthcare problems differ greatly from non-Indigenous peoples. For example, poor water supply and lack of resources because of their remote location are factors that are not considered when providing healthcare for non-Indigenous individuals, but are vital problems for Indigenous communities and reserves. Issues of discrimination and inequality faced in the past and present have created a high rate of mental illness and suicide, especially in Northern Ontario. Results of residential schools, cultural cleansing, family disruption, and generational effects of all of these have resulted in increased mental health issues as Indigenous peoples are unable to cope with stress and anxiety in their traditional ways, as those traditional ways have been destroyed by colonial powers. Canadian legal system and Indigenous peoples. This agreement was signed by Canada's Health Minister, the Province of Ontario, and the Anishinaabe Nation with an aim at decolonizing the provision of care in Ontario's north. The first agreement between the three governments includes a series of principles that any First Nation-led healthcare system must adhere to, while vowing to pool money to better address poor health outcomes in Ontario's northern and remote reserves. Currently, it is the federal government's responsibility to provide healthcare for Status Indians, but in this case, it is the Ontario provincial government working with Canada's health minister to allow the Indigenous peoples in Ontario's north to control their own healthcare and do so accurately and with specificity. Indigenous recognition. Giving Indigenous groups the right to control their own healthcare creates further recognition of Indigenous laws and encourages cohesion between the Canadian government and Indigenous peoples in order to improve relations and create further discussion and collaboration between Indigenous peoples and the Canadian government in the future. This supports the notion that Indigenous peoples have full autonomy over their culture and ways of life, even if it is different from that of the rest of Canada. This also gives Indigenous peoples the right to self-governance, which is a huge stepping stone in restoring confidence in Indigenous communities and acknowledging that their healthcare issues are important too.